Loncastuximab tesirine, also known as Zynlonta, is a medication used to treat a specific type of cancer called large B-cell lymphoma. This medication is an intravenous solution containing 10 mg of antineoplastic monoclonal antibodies. It works by slowing down or stopping the growth of cancer cells in the body. Patients who are prescribed Zynlonta should follow their healthcare provider's instructions carefully. The dosage and frequency of the medication will be determined by a healthcare professional based on the individual's condition. It is important to take Zynlonta at the recommended time each day to achieve the best results. Zynlonta can provide significant benefits for individuals with large B-cell lymphoma. It is essential to discuss any concerns or questions about this medication with a healthcare provider. This medication is administered through a vein injection, which is usually done once every 3 weeks by a healthcare professional. The dosage is determined based on your medical condition, weight, and how your body responds to the treatment. Before receiving this medication, your doctor may also prescribe other medications, like dexamethasone, to reduce the risk of side effects. It's important to follow your doctor's instructions for all your medications. If this medication accidentally leaks into the surrounding tissue of the injection site, it can cause severe damage to the skin and/or muscle. If you experience irritation, redness, swelling, or pain at the injection site, it's crucial to inform your doctor immediately. Side effects of Zynlonta 10 mg intravenous solution may include tiredness, nausea, diarrhea or constipation, abdominal pain, vomiting, decreased appetite, or muscle/joint pain. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. Serious side effects may occur with this medication, but it has been prescribed to you because your doctor has determined that the benefits outweigh the risks. Your doctor will carefully monitor you to decrease your risk. Contact your doctor immediately if you experience any serious side effects, such as signs of too much body fluid, such as new or worsening swelling or puffiness, weight gain, chest pain, shortness of breath. Zynlonta can decrease bone marrow function, leading to a low number of blood cells such as red cells, white cells, and platelets. This effect can cause anemia, a decreased ability to fight an infection, or easy bruising/bleeding. Notify your doctor right away if you develop symptoms such as unusual tiredness, pale skin, signs of infection, such as a persistent sore throat, fever, chills, or easy bruising/bleeding. While this medication can commonly cause a mild rash that is usually not serious, it may be difficult to distinguish from a rare rash that could be a sign of a severe allergic reaction. Seek medical help immediately if you develop any rash. Although a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms of a severe allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. If you are in the US, call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. Before starting Zynlonta 10 mg intravenous solution, make sure to let your doctor know if you are allergic to it or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss this with your doctor or pharmacist. Inform your doctor or pharmacist about your medical history, especially if you have had recent or current infections, or if you have liver disease. Zynlonta 10 mg intravenous solution may make you more sensitive to the sun, so it's important to limit your time in the sun and avoid tanning booths and sun lamps. Always use sunscreen and wear protective clothing when outdoors, and be sure to tell your doctor if you get sunburned or have skin blisters/redness. This medication can also make you more susceptible to infections, so it's best to stay away from anyone who has an infection that can easily spread, such as chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, make sure to talk to your doctor for more guidance. Before getting any immunizations or vaccinations, let your healthcare professional know that you are using Zynlonta 10 mg intravenous solution. It's also important to avoid contact with people who have recently received live vaccines, such as the flu vaccine inhaled through the nose. To reduce the risk of getting cut, bruised, or injured, use caution with sharp objects like razors and nail cutters, and avoid activities such as contact sports. If you are pregnant or planning to become pregnant, it's crucial to let your doctor know. You should not become pregnant while using Zynlonta 10 mg intravenous solution, as it may harm an unborn baby. Women using this medication should inquire about reliable forms of birth control during treatment and for 10 months after the last dose, while men using this medication should ask about reliable forms of birth control during treatment and for 7 months after the last dose. If you or your partner becomes pregnant, be sure to talk to your doctor right away about the risks and benefits of this medication. It is not known if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding while using this drug and for 3 months after the last dose. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. This is why it's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's important to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone takes too much Zynlonta and has severe symptoms like fainting or difficulty breathing, call 911. Otherwise, contact a poison control center immediately. In the U.S., you can call 1-800-222-1222 for your local poison control center. In Canada, contact a provincial poison control center. It's important to have regular medical tests while using Zynlonta, including blood count and liver function tests. Make sure to keep all medical and lab appointments as advised by your doctor for more details. Make sure to take each dose of Zynlonta 10 mg intravenous solution Antineoplastic Monoclonal Antibodies as directed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to establish a new dosing schedule. You won't need to worry about storing Zynlonta at home, as it is only administered in a hospital or clinic setting. This medication is used to treat a specific type of cancer called relapsed or refractory large B-cell lymphoma. It is given as an intravenous, infusion over a period of time determined by your healthcare provider. The dosage and timing of the infusion will be determined by your healthcare provider based on your individual condition and needs. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.